television affiliates for broadcasting tonight's discussion. As many of you know, I posted a social media release a few days back, and it seemed to re-energize some apprehension about the virus and its effect on the Wabash Valley, in particular the forecast and influx of critical ill patients that are going to certainly swell and peak in the upcoming weeks here in the Wabash Valley. I immediately got some immediate requests, and I thought, well, I understand my role as a county health commissioner and also as a practicing physician, but I certainly am no COVID-19 expert, nor can I speak to the enormities that have taken place for healthcare delivery preparedness from Regional Hospital and Union Hospital and our outlying communities. We've assembled this panel here tonight to answer as many of those questions as we can. Due to our own attention to social distancing and avoiding gatherings of 10 or more individuals, our panel size is purposefully limited. We would love to have had Mayor Duke Bennett, some business leaders, religious leaders in the community, education representatives, just to name a few, but our space is limited. We all have a very good understanding and our own personal desires for the community to get back to our regular lives, to help restore our local economy, our federal economy, our state economy, by returning to work, getting our kids back to schools, and resuming social activities. We all would love to put this terrible ordeal far behind us, but the reality is much different. The influx of illness that is associated with COVID-19 has yet to peak in the Wabash Valley, and there's no greater time than the present, today, right now, to critically examine every aspect of our daily lives, to ensure that we are doing absolutely everything in our power as individuals to limit the spread of the disease. But we have to do this perfectly, and we have to do this now. I've gotten the feeling by speaking to many people that there's some sense in the community that this isn't that bad here, or maybe this thing's going to miss us altogether, and that's far from the truth. There's a wave of sickness that is coming to the valley. It's mounting daily, but we have one variable yet to be determined, and that's the size of that wave. I'm pleading with everyone tonight, as is everyone here, to act together, to come together as one cohesive group to help limit the burden on our lives, our healthcare delivery system, and truly the way that we live our lives in the Wabash Valley. Questions tonight will certainly surround things like treatment options and testing, universal masking, social distancing, our preparedness, and the idea of self-preservation, meaning what can we do at home to protect ourselves and our families from this virus. We hope to answer as many questions as we can tonight. Our overall messaging will undoubtedly reiterate what's been handed down from federal broadcast and state broadcasts, and that's to heighten our sense of awareness, to take this threat with the critical sense of urgency that it demands. COVID-19 is not some theoretical black cloud that will soon darken the skies around us, something that we can see. The virus is here among us, with deaths already starting to occur and ventilators already being occupied. Many more deaths and critical illness is expected in the weeks to come. Positive tests are starting to exponentially increase. We have no choice moving forward to try to downplay the seriousness of this illness. But if we answer the bell to genuinely appreciate the seriousness of this infection as it continues to unfold, then we certainly can make a difference in the overall impact that it will have when it has left us. A few introductions. I have with us tonight Joni Wise, Administrator for Vigo County Health Department. On my left, Dr. Prashant Patel from Union Hospital. Back left, Brendan Kearns, County Commissioner. Back right, Mr. Steve Holman, CEO of Union Hospital. And directly behind me, Nathan Voy, CEO of Regional Hospital. Our moderator tonight is Ms. Kristen Craig. We certainly thank everyone's participation. Thank all of you for joining in and for your questions you've submitted. Craig.
All right, thank you so much. This is a very important evening that we have here this evening. On behalf of the business community, we have been receiving so many questions, so it's great that you all will be able to help answer some of these this evening. Thank you to all of you who submitted questions. Unfortunately, we're not able to go through all of them. We're quite a good deal submitted. We have edited them down a little bit, but we are trying to really encompass every theme that was submitted to us this evening. If you have additional questions, they can be answered via the Vigo County Health Department page, and we'll share that information again at the end. So the first question this evening is for Dr. Brucken, and this comes from Deborah. If you had the virus and recovered, can you get it again? And after recovered, are you tested again to see if you then test negative?
We do not recommend any type of follow-up questioning or testing to see if you will test negative after a period. We do not know of any cases of reinfection. So there is some sort of immunity that is garnered from the previous infection.
Great. Next question is for Joni. This is Tiffany from Terre Haute. What kind of extra precautions should we be taking when living in a home with someone who is an essential employee?
If you live with someone who's an essential employee, you're going to have them be hypervigilant. When they get home from work, have them take off their shoes, leave them at the door. As soon as they come in, they need to wash their hands, wash their face. Take off the clothes that they've had, remove the clothes, and place them in the washing machine. If they're unable to place them into a washing machine, place them into a plastic bag, and then immediately take a shower. And if it's at all possible, try to stay away from other members in the family. That's not always availability, but if it's possible, sleep in another bedroom.
The next question is for both of our hospital CEOs, and you could choose who gets to answer first. In a community our size, are the hospital's staff to address this new health issue? Can you give an update on hospital bed capacity and then ventilator capacity as well?
Thanks, Kristen. So first, I want to reiterate that this is a community problem. It's not a regional hospital problem or a union health problem. And Steve and his team and my team have been working almost daily to try to address this and make sure that we can support each other wherever necessary. But I'll answer just quickly for regional. So I'd say most of the last 2 weeks at Regional Hospital have been spent on preparing the facility for a possible influx or surge of patients. And what our capacity is depends on, I think, 3 variables, certainly our staff capacity, our physical space capacity, and our equipment capacity, things like ventilators and the such that you hear in the news right now. Based on what we're seeing right now with redeploying staff into areas to support the surge, we're estimating that we can handle about 150% of our normal capacity for ICU patients and about 200% of our normal ER visit capacity. But I'll reiterate, those will not be ideal conditions. Those are truly only things we want to have to do if we have no other options in the community. Steve.
Thank you, Nathan and Kristen, and I want to reiterate my thank you to the health department. They've taken a Wabash Valley lead in this and pulling this together this evening to be able to inform the community and answer questions, alleviate fears and such. Dr. Brunken, thank you for that, Joni. But the question having to do is, our healthcare system's prepared? I want you to know, as Nathan has just said, that we drill and we practice this regularly on multiple occasions during the year, and we work collaboratively together between the two systems to practice for this type of thing. Now, this pandemic is something we've never seen before, but the processes and the policies that are put in place prepare us for this. I want to assure you that the resources of both systems, I can speak specifically to Union, we have over 3,000 associates. We've got over 460 physicians on staff. We've got over 1,600 nurses, and every one of those are here to help the members of the Wabash Valley in a very coordinated fashion. They are healthcare heroes across the organization, from the EMS to the fire department to both hospitals to the clinics that are running, and we're here for the community. I would tell you specifically, the question did go to ventilators and bed capacity. As Nathan had said, we're able to repurpose many of our rooms. We have several hundred that are available. We are currently, I would tell you, normally we would have ICU beds that are around 40. We've been able to double that, and we feel like we have the ventilators, the staff, because a good part of our operation throughout the state with not doing any outpatient surgeries and such, we're able to redeploy that staff into new areas, as I know Nathan is doing also, and training them, having boot camp for them. So we feel confident that we've got the ventilators and approximately 80 ICUs to handle the surge that Dr. Brunken was just talking about.
Thank you. Our next question is for Joni. This comes from Greg. Should people still be out traveling to events? I think his specific question included something about auctions and basically public gatherings.
Those aren't essential things that people should be attending. Our message is for people to stay home. going to online auctions or participating in online auctions and traveling and congregating. If it's not necessary, don't do it. You don't know if you're contagious, if you're a vector, or anyone around you that might be at these groups might be infected. So please don't go if you don't have to. Stay home.
Thank you. Next question, Dr. Patel. Which patients should come to the hospital?
So in the times of COVID-19, we worry about the symptoms of COVID-19, but I want to tell you that you need to worry about the symptoms of other things, heart attacks, strokes, etc. Those things still occur. If an elderly person falls and has leg pain and cannot stand, they might have a hip fracture. Those are things that still need to be dealt with, and they need to be dealt with in the hospital. So if you were thinking about going to the hospital before this time, it's still a reasonable thing to do. Now, I want to address specific symptoms of COVID-19. Several of them are flu-like, including fevers, a cough, body aches. Some people have even described GI symptoms such as diarrhea and abdominal pain. All of those are consistent with COVID-19. They do not mean you need to come to the hospital for COVID-19. I think the best way to think of this is if you have chest pain or you are short of breath, those are reasons to come to the hospital if you think you have COVID-19. Otherwise, 90+% of these cases can be managed at home with conservative therapy, including Tylenol for fever. It's been said that ibuprofen may not be as beneficial, but that's still yet to be seen. Tylenol is a reasonable option. Fluids for hydration and just taking care of your loved ones. And if you're ill, try to wear a mask at home.
Kind of as a follow-up to that question as well, Dr. Patel, how is it decided who gets tested and who doesn't?
If you are sick enough to be hospitalized, you will be tested at this point. There was a ramp up in testing, and now we have more and more testing available, and our turnaround times are improving. If you are not sick enough to be in the hospital, having a positive test or not having a positive test won't change how you're being managed. Whereas if you're sick enough to be in the hospital, that allows the healthcare system to help position you in the hospital to prevent further spread of the disease. But if you are not sick enough to come to the hospital, typically as of right now, you need not be tested. That could change in the future, but as of right now, you got to be pretty sick to be tested.
Dr. Brucken, we'll go back to you here. This question is from Sandra. When can we expect the virus to peak, and how soon can we expect businesses to reopen afterwards?
It's interesting that the statistical models really look at the highest taxation on the healthcare delivery system as far as those numbers. So the peak of it is not necessarily the peak of the virus in society, but they look at the number of deaths per day, and they kind of say, hey, this is when the apex of that curve is. The projections are anywhere from April 15th all the way to April 24th. It really depends on who you read. The gist of it is in the next 2 weeks at some point, 2 to 3 weeks. And that's when our influx of patients should be the highest and the number of deaths should be the highest before we see any type of downturn.
Okay. Steve, a question for you regarding employers. It's been a challenge for employers to retain their employees, but they certainly have been challenged by the federal government to do so with the legislation that's been passed. How are you managing employee retainment?
Yeah, so our employees are our most important resource through this entire time, and our associates. First of all, first and foremost is their safety and helping them feel safety while they're in the work environment. That means all the way from who cleans the facility to who maintains it to the frontline nurses and doctors that are there. So one is getting the proper personal protective equipment and helping them. Those guidelines have changed as we come out, as Dr. Brunken I'm sure will cover from the CDCs, but that's one. I think then we are encouraging as much staff as possible that's in a non-direct role to work from home and giving them the opportunity to do that. We're redeploying staff to various areas and cross-training, as I said earlier.
Excellent. Another question regarding employers, and this is for you, Joni. This is Kathy from Sealyville. What happens if a business that is essential has an employee who tests positive for the virus? Is the employer notified? Are coworkers notified?
HIPAA still protects an individual's medical testing result. We start investigations on communicable diseases at the Vigo County Health Department. And what we would do is work with the person who tests positive to see what type of work they had, who they've been around. And if we feel that it's necessary to tell the employer, we'll tell the employer. We've worked with employers before with other communicable diseases. But what we found with COVID-19, people that are positive are very open with their employer because they want to protect the other people that they worked with. They want to protect the other people that they were around. And so we found that that hasn't been an issue, but HIPAA still does protect that person's medical rights.
As a follow-up question to that, again for you, Joni, is my employer required to give me paid time off and/or FMLA leave if I am sick or have tested positive?
I think as president of the chamber, you would be better to answer that question than I could.
Sure. So I'd be happy to offer a little bit of information. There is new federal legislation that does provide for paid sick leave and expanded FMLA for individuals who are sick, have tested positive, or also have childcare issues because of the closures of school. There's a lot of complicated information that goes along with this. The federal government did roll it out very quickly. There are a lot of rules, but there are a lot of exceptions, including for essential workers who would not be eligible for those things. The Chamber has a resource page that you are welcome to look at on our website that has lots of links to information. The Indiana Department of Workforce Development is rolling information out daily. There is a lot of clarification that needs to happen around these things, but the short answer is yes, most likely, but you need to inquire a little bit further. Next question goes to Dr. Patel. How can you calm fears with your patients and really in the community at large?
Well, first, this is a very exceptional time, but I do feel reassured that we are surrounded by exceptional healthcare providers, from the first line responders, the EMS, the fire department, to the nurses and respiratory therapists that are truly in the thick of it every day. We've been meeting as a group of physicians and physician leaders frequently via teleconferencing at least 3 to 4 times a week to discuss the newest updates in healthcare delivery for this disease, as well as what our local abilities are. And I think, as you've heard, we do have quite a few resources available to us. And one of the most reassuring things I saw today walking into the hospital was the empty beds. They're everywhere. We have an ICU that is only at a quarter capacity currently at Union, with an extra unit available if necessary. And so I do feel that we are prepared, and now it's a matter of working with the community to flatten the curve so we don't overwhelm the capacity that we have built.
Question back to you, Dr. Brecken. This is from Wanda. Is the virus airborne?
This is a respiratory-borne virus. So yes, it is airborne, but airborne means a variety of things. Droplet transmission are the larger things that are excreted from our body, and they fall typically close around us. These are covered in saliva and mucus and things. This would be expelled during a deep cough or a sneeze, the things that you can visually see come out of someone's mouth. That is the importance for masking, because these masks that we're recommending in the community, all the way from the CDC down to myself personally, if you're wearing a mask, it's to prevent your particulate matter from escaping your body. The larger droplets, we believe from laboratory testing, are the most contagious to other people. There is a fine aerosol that theoretically could also be there. We worry about our healthcare providers as well. We use special masks called N95, which limit the transmission of the aerosols in the air. We do know it comes from the air. It is not foodborne. You can't get this from eating it or ingesting it. There are comments about fecal oral transmission, and yes, we can see it in stool, but we've not been able to pin that down. So you have to protect yourself from the air immediately around you. And remember that the universal masking is to protect others from you, not you from others.
I think, could I emphasize what Dr. Brecken mentioned about the N95 masks? Those aren't necessary in the community as a whole. The standard cloth masks that everybody has been making and delivering to the hospitals, which we are very grateful for, are more than adequate to protect yourselves and protect others around you from transmission. N95 masks are designed for high-risk situations such as during CPR or when a provider is putting a breathing tube in somebody that's infected to prevent those very fine particles from infecting the healthcare provider. So do not feel that you need to wear an N95 mask. And if you have clean, unused ones, please bring them to your local fire station or the hospital or a clinic near you.
Excellent.
Thank you. Dr. Patel, question for you. You are a cardiologist. How has COVID-19 altered your cardiology practice today, and what do you want your cardio patients to know at this time?
We've been teaching a lot of 80-year-olds how to Zoom in the last few days. Today I saw 10 patients, which is a lot less than I typically see in a given day, but we triage them to identify the highest risk patients that still need standard cardiac care to prevent them from getting sick so we can avoid them ending up in the hospital for other reasons. So we are doing telehealth in our office, which is becoming more and more prevalent. So for patients and the community out there, if you are not feeling well and you are scheduled for an appointment with a provider that is offering you telehealth services, I urge you to take them up on that, because that's what's going to keep you healthy in this time and keep you out of the hospital where it could be more detrimental to your health.
Absolutely. Brendan, this question is for you.
Sure.
What is being done to help the homeless population through this pandemic?
Well, Kristen, that's a tough one. I'm going to kind of wing it, if that's okay. All of us in this room here deal with the homeless in some form. Dr. Brucken and Joni and I were talking about a situation, I think on Friday, about a person that was seeking care because they haven't had a meal in 4 or 5 days. And I'll leave it at that. But last July, we did a count in Vigo County, and it proved to us that we have about 600 people that are considered homeless in Vigo County at that time. During the wintertime, we saw our numbers decrease, but we're starting to see them come back. This has been a very interesting exercise where the places where the homeless congregate during the day are shut down. The Vigo County Library has become our unofficial day center, our gathering place for our local homeless. They go there to use the computer, they seek shelter, the bathrooms are there. It's closed. And then the other locations they hang out are certain restaurants that allow them and feed them. They're closed. And so, it's changed everything for everybody, but in particular with the homeless community, it completely disrupted them. We have housed homeless, people who are in shelters. And I tell you, a lot of our greatest fear is if that shelter, a shelter, has one case. And the shelters that I interact with, that Joni interacts with, they have isolation plans in place. But you just hope that you catch it in time. And, there's so much uncertainty with this. We just hope to God that this does not happen. I've worked with a couple shelters on ways to get the people who are housed inside outside by having them on the same campus in tents. There's a lot of things that we're doing in the background, but something, if there is any benefit to being homeless, and this is going to sound twisted, homeless are isolated people. Today I interacted with 6 homeless individuals in one area. They were spaced apart from each other. Checked on them, seen how they're doing. I checked on a couple other people. They're staying away from each other because they're isolated by nature. But we're seeing an issue with our food banks right now, not our food banks, our soup kitchens right now. Soup kitchens that were open 5 days a week have gone down to 3 days a week because they're experiencing a volunteer shortage. So it's an ongoing issue. We're reactionary in everything right now, and we're just doing what we can to ensure that everybody's safe, but the homeless population is very vulnerable. And Vigo County is an awesome community. People step up. We volunteer, we help as we can, and we are absolutely seeing the strength of this community right now in this situation.
Agreed. Dr. Brecken, question for you. This is Dave from Park County. Can the microwave oven be utilized to kill the virus, and how about putting patients in a hot room?
To speak to this in general terms, this virus, once it's on various surfaces, is really not all that hardy of a situation. Plain old soap and water can eradicate the virus from your hands. The countertop surfaces, the non-porous surfaces, the virus can survive, we believe, for 2 to 3 days at most. And that's why we encourage people wiping off with any household cleaner. You can make your own cleaners at home. The CDC actually posts a very nice list of how to make your own cleaners if you're running low on your supplies. Hand sanitizers, washing your hands effectively. Heat theoretically could deactivate really anything, but we're not encouraging anyone to put items in the microwave. Okay, as Brendan pointed out to me earlier, masks, just like the ones that I wear out in public, they can contain a piece of metal. If you're using cloth masks at home, you do not need to microwave them. You can put them just in your regular wash. Good old laundry detergent kills the virus as well. And again, it just speaks to the cleanliness issue. Now, with porous surfaces like clothing and things, it's going to be absorbed. You're not going to necessarily have it off of you. Anytime you're handling, though, a porous substance, you need to be thinking about, my hands are now dirty. I need to get to the sink and wash my hands with soapy water. 20 seconds. Say a little nursery rhyme in your head, whatever you need to do, and making sure we're educating our kids and our older kids in our household how to wash your hands appropriately. The same goes with hand sanitizer.
Absolutely. Joni, this is a question for you. It kind of relates back to something we talked a little bit about earlier, but this is from Ray. Expand a little bit about how the county handles notifications when someone does test positive, and how close of contact must they have been with that person in order to be notified?
Okay. Both hospitals have 24/7 contact information for health department employees. And so we're notified immediately, and then our head nurse that's working on, or excuse me, the nurse that has been handling the lead investigation notifies the patient right away. And then she starts the immediate contact investigation to see who that person had been around and all the, where they worked, did they live with people, have they traveled, a whole battery of questions. Our environmental division staff and our nurses also do part of these investigations, and I have to say they have a list of questions that they go off of, but they also think outside of the box and they use common sense. The second part of the question in regards to how close of a contact, there are so many different variables. Were you inside with the person, outside with the person? Were you in an elevator? How close of a contact were you with them in your working environment or your home environment? Were you in an elevator and a person sneezed? Or were you in the office when they were coughing and sneezing? Did they wear a mask? But again, those are things that we go through when we do the contact investigation and questions that we ask the people that they were around. And I find that the people that are positive have just been so cooperative, and same with the individuals that are contacts of them.
Absolutely. Dr. Patel, question for you. How can those struggling with mental health issues get outpatient services?
I think the first thing is, if you are established with a mental health care provider, you still reach out to them directly. As I mentioned, telehealth is now available. Not every provider may have the capacity to do that, but I think the first place to check is with your own mental health care provider. And if that's not available to you and you feel like you are a danger to yourself, or if a family member feels or a friend feels somebody is a danger to themselves or others, the emergency room is still an appropriate place for those individuals. You can also call the Union Hospital hotline or regional hospital as well if you are in distress to obtain care.
Absolutely. Perfect segue. Our next question is for Steve about the Union Hospital hotline. Talk to us about its availability.
Yes, so Union Hospital is staffing a hotline. We call it the COVID-19 hotline. The number is 812-238-4871. That's again 812-238-4871. It is staffed by clinical nurses, registered nurses, and it's open Monday through Friday, 7 a.m. to 7 p.m. We tried it, and it is there as a resource for the community to answer any question or to get you information, to get the community information about any resource that's needed, whether it's symptoms, whether it's treatment, whatever, testing, whatever it may be. We did have it open 7 days a week. We're getting about 150 calls a day, and we've had over 3,400 calls on that hotline so far. So there's a lot of questions out there in the community. We did find the first weekend that calls really dropped off, so we weren't covering the weekend. If we do have a demand for it, we'll open it up on the weekend.
Excellent. This is a question for both of our hospital CEOs. This is from Danielle from Sugar Creek Township. What are hospitals doing to protect their workers, and when can we expect additional PPE supplies locally for our healthcare workers and first responders?
Yeah, so there is a lot of public information out there right now having to do with personal protective equipment that we call PPE, and there is a national shortage of it. A lot of it came out, or a lot of it does, if not most of it, comes out of China, and some of that supply chain was cut off for at least a period of time. So we're all in a rationing mode, but what I want to assure the community and the patients and the workers and our associates is that we have enough personal protective equipment to take care and do what is needed. We're going through different parts of our supply chain to be able to get that, and we ration it because we certainly have a lower supply, but that is getting better. I do want to give a shout out to just several individuals because they've helped with this. First of all, Dr. Christina Box at the Health Department of the state of Indiana. She's the doctor that's over the entire state. She's called me personally at 7 o'clock in the morning just to wonder how our health systems are doing. I've personally been reached out to by U.S. Senator Todd Young, U.S. Senator Braun, U.S. Representative Larry Bashan, State Senator John Ford, and State Rep Bob Heaton. They're all involved. They all want to know what they can do to help. There is a state, federal warehouse supply with this. It's being distributed to the states. In the states, we actually got a shipment from that just a couple of days ago. So they're watching over to make sure we do keep enough PPE. Nathan, do you have more for that?
Yeah, thanks, Steve. We're doing a lot of the same things that Steve mentioned for Union Hospital, but again, I think the acronym of the year is going to be PPE. We're very closely monitoring our inventory of all required PPE to make sure that we have adequate supplies. We do have adequate supplies. We don't have extra supplies is the way we talk about it. And I think all health systems are doing that to make sure that they have the right supplies for the full duration of this pandemic, no matter how long that lasts. So that's things from monitoring your supply levels on a daily basis. We're spending a lot of time educating our frontline workers on the correct types of PPE to be wearing in certain situations. In certain cases, we're actually reprocessing PPE. So things like goggles and face shields, we're able to clean those and redeploy those back out to the floors to make sure we have an endless supply of things like that. We've also received some shipments from the Strategic National Stockpile, which have been very helpful and very beneficial. And as Steve mentioned, a lot of the federal and state government officials have reached out to us to ensure that we have adequate supplies. So the support is definitely there and definitely appreciated. But yeah, other than that, it's pretty much the same types of things, just making sure that we have the right equipment, that we're educating people on how to use it, and that we're being prudent with how we are using it so we don't run out.
I have something to add.
Go ahead.
Our EMA, Vigo County EMA, has been instrumental in coordinating the PPE push out to EMS, to law enforcement, long-term care, ancillary care, the jail. And what they have done is looked at what we already had in place, and each time, along with donations and the Strategic National Stockpile, and being able to assess what's the greatest need. What all of those entities that I named have already in stock, what the anticipated need would be, and where's the greatest need. And so they've been very beneficial and have been working super hard in their cause to help us with the COVID-19.
Yeah, just a quick thing to add. Healthcare providers, and Dr. Patel can attest to this as well, we have educated ourselves tremendously about how to conserve our PPE within the hospital. That is our only defense against this. That's our frontline defense, is we're right there with these patients that are under investigation or presenting with signs and symptoms. And again, speaks to the issue with the N95 masks. And if people are finding them in their warehouses or wherever else, they need to go to the healthcare providers so that we can use those. And we certainly appreciate the donations that have come from corporate America our way as well, as with the supply lines through the hospitals and through the government.
Brendan mentioned earlier, we have a very giving community, and through the chamber, we witnessed the local contractors association stepping up and making some significant donations of those PPE. So, again, we do have a great community here, and happy to be part of it.
So.
Dr. Brecken, a question for you. Andrea from Riley, do you believe the coronavirus will die off during the summer months, and how strong of a possibility will it come back next fall or winter?
I think virologists actually believe this is going to be seasonal. We should get through this first wave, if you want to call it that. It should lessen or dampen down through the hot summer months. It will be back this fall. Hopefully, we will have established what we term as herd immunity to some degree. It should not kill as many people, we'll put it that way. There still will be significant morbidity and mortality from this late into the fall. A lot like influenza, it can come back in the wintertime. We expect it to this year if it mirrors the SARS 2003 virus, which right now we think it probably will. It had a seasonal peak and then kind of died off, which is very encouraging. And of course, right now we are really pushing to get vaccines developed at a record, just a neck-breaking pace for that. Hopefully, we'll have something available. It likely will be 18 months to 24 months, so we will have a second surge, yes.
All right, thank you. Question for Dr. Patel. Another question from kind of the employer's side of things. We have several large manufacturers here in town, so if they have an employee on a shift who is showing signs but cannot be tested, what actions should they take regarding employees that may have come in contact with that person?
I think that's probably a better question for Joni.
Yeah, absolutely.
Read it to me again.
24, question 24. So if there is a employer that has an employee on a shift who is showing signs but doesn't necessarily meet those qualifications for being tested, what actions, beyond sending them home, what actions should they take regarding the employees that they may have come in contact with?
One, we would ask the person to self-quarantine, and again, it would go back to how close of a contact were they with the people, how long were they around them, but it would just be to monitor the situation and look to see if others are becoming ill.
And I would speak to that as well. If you're at a job in an essential role and you do fall ill, you can inform your employer, and that person needs to get home, number one. But we also don't have to jump to the conclusion that person has COVID-19. So we have to think they could have anything else. They could have bronchitis, just a common cold, even just a sore throat, because those things are still occurring as well. So we don't need to assume just because our coworker has gone home ill that they are stricken now with COVID-19 and hit the panic button within that community. We just have to be vigilant in observing how this plays out. But that person should immediately go home.
Okay. I'm going to jump around just a minute here. Dr. Bracken, I'll go ahead and send this question back to you. What is the best way to tell if you have the virus, pneumonia, or the flu?
A lot of the symptoms overlap. So as Dr. Patel touched on earlier, they're very vague and nondescript symptoms, but if people just generally don't feel well with malaise and not smelling well and sinus congestion and all of these things that can overlap with all of these conditions, they need to speak with their healthcare provider. Ask some questions via telephone because they're very simple questions to answer. If you get to the point where you're having difficulties in breathing, you feel like I've got to get some help, that should be your cue to get to the emergency room. Seek EMS if we need to try to figure this out. You're not going to know until you get some sort of objective assessment from a healthcare provider.
Excellent. Joni, a question for you. This is from Constance. I've heard now is not the time to be getting groceries. Is this true? What steps can I take to protect myself if I do have to go out?
All right. We know that we have to have food, and we know that we have to go to the grocery store to get them. But is that trip to the store necessary? Are you going for a jar of spaghetti sauce, or are you going to get your items that you've predicted that you actually truly need? I went to Fresh Time yesterday. I made sure that I had on gloves, a mask, and I had my glasses on to protect my eyes. I got the items that I needed. I didn't fondle the stuff in produce or unnecessarily touch things if I didn't have to. I didn't take my cell phone with me. As soon as I got out into the car, I took off, or before I got into my car, I took my gloves off. I washed my hands with a Sani wipe. And then when I got home, I took my shoes off before I went into the house. And so just very hyper vigilant, very conscientious of what we're doing. But if you don't have to go to the grocery store, it's an unnecessary trip, don't go.
No, good advice.
And may add as well, maintain your social distancing.
Yes.
One of the mental cues that I have is I think that, I almost picture people walking towards me as though they're smoking. They're emitting this large plume of
Yes.
smoke around them, and I'm going to take an extra wide berth around them. the aisleways of grocery stores and really any type of public space are occupied by people all sharing the same air. So if you can limit your distance from people or expand your distance from people, that's certainly going to help. And being vigilant with hard surfaces. The other thing with going to the grocery store is please send one person from your family as your grocery store person. Don't send husband, wife, and 3 kids shopping. Okay, you just need one person to go get your groceries. I know several grocery stores around are also doing pickup service where you can just go and pop your trunk open and they'll come out and deliver it to you. It's a great service that keeps you out of the store, yet enables you to get your necessities that you need.
And some stores have certain hours for people that are elderly or have compromised immune systems. So be conscientious of those, and if you aren't those categories, try to stay away during that time frame.
Yeah. Kudos to our restaurants and retailers who have really shifted quickly to be able to serve people in a different way.
Absolutely.
Question for, again, Dr. Brucken. This is Becky from Sullivan. What are the chances people who were extremely sick during December and tested negative for everything had coronavirus?
This is it's an interesting question because I actually get posed to me quite a bit. We know this virus. We know where it started from was in Wuhan, China. We know roughly the timeline that it started. If it would have preceded and been here, we would have had a nidus of death like Wuhan had, where 3,700 people perished. So we know that's where it started. So if it precedes that or the nidus of infection that came through Washington State, that was the United States' first introduction of the virus as well. So you have to look at the timeline through there. Certainly there are people in this community that have been exposed to the virus and had very little or even no symptoms, and that has carried through internationally. People are shedding virus, they're getting exposed to the virus, they have no symptoms, they don't even know that they've had it. And that's, again, the cause and the police. Keep yourself from shedding that virus asymptomatically. The numbers are staggering. Some of even the German studies suggesting even 50% of some of their studies are showing that people were asymptomatic. They had it and never knew it.
Wow. Yeah, interesting.
But that's a good point because that's where herd immunity comes from. Okay, so that's actually works to our benefit.
Dr. Patel, kind of going along with that, is testing available to check for those antibodies that exist after having the virus?
So currently not commercially available. The test, I want to be very clear, the test that we have now is a nasal swab. Some people liken it to poking your brain, but it tests for actual viral RNA. It's similar to DNA that shows that the virus is replicating. That is for active people that have recently been exposed and people that are currently or recently ill. The antibody testing is used to identify people that might have been exposed and have developed immunity. That testing is not yet here. It will be available. I personally know 3 healthcare providers in other cities that are contributing their own blood to help establish the titers because they have recovered from illness. So it is coming. That will be available down the road, and it will be an important test for us to truly understand the extent of this disease, as 50% of people could be completely asymptomatic.
Okay. Brendan, next question for you. We gave you this specifically because of your love of the outdoors.
Sure.
Is it safe to go mushroom hunting away from other people, and can the virus live outdoors in the woods?
Okay, and that's from Barbara, right?
That is from Barbara.
Okay, so Barbara, if you are watching right now, you need to text me the best locations for finding mushrooms right now, because my wife is trying to find them where we normally go, and they're just not there. But yeah, we were talking earlier about how many people are outside. I went home for a break this late afternoon. I ride my bicycle. I passed Mr. Holman 4 or 5 times. We live out in the same area. Joni's out there too, and the 3 of us have all talked. I have never seen so many people outside before in my life. That's good and that's bad. There's mixed messaging out there. We're being told to stay inside, and then we're told to do what? Go outside. Yeah. But I think the key thing here is stay away from somebody. If you're going mushroom hunting, first of all, you're going to do that by yourself anyway for the most part. But it's not the time to meet a new friend and go for a walk in the woods. Save that for when things balance out, and hopefully that's soon. But yeah, you want to get outside. You want to enjoy life. It's good for your mental health, and I'm not qualified to say any of this stuff other than I know that I'm dealing with the stress like all of us in here are. And my way of getting out and decompressing is going on the river. I haven't been able to do that, so I go out and try to enjoy what I can outside. So yes, go mushroom hunting, do what you can, be outside, clear your head in some form. As far as whether or not it lives outdoors in the woods, I have no idea. But since we're talking about mushrooms, make sure you know what mushroom you're picking so that you don't get sick from a poisonous
It's a
mushroom.
whole nother set of problems.
Right.
But
So
what
let
are
one of the doctors
doctors
touch that
address?
part.
Just a point of clarity, we're asking people to stay at home. That does not mean stay in your home. We're not trying to ground you like you're a 10-year-old who's in trouble. You don't have to go to your room and stay there. We want people to be outdoors around their homes. We want people to go for walks. We just want you to keep a comfortable distance from people. And if you're sick, that's not the time to invite your mother to go for a walk with you. Wear your mask. I know there was a question coming up, and I'll just touch on it now. Do we need to wear a mask outdoors? If you're going to be in a closed environment type of thing, if Dr. Patel and I are sitting on the back porch in opposite lawn chairs and we've got a nice cross breeze growing through, probably not. But if the breeze is taking all of my air right to Dr. Patel, it wouldn't be the greatest thing. So we need to be conscientious about that. So wearing a mask outdoors, particularly when you're in public, is a wonderful thing. Being outdoors is a wonderful thing because we're all dealing with the mental health strife of this. Okay, it does not escape anybody. So be outside with people. Just be responsible. Keep your gatherings to less than 10 people. Okay, because that really cuts down on crowding. Remember, the higher the level too of the common, or the higher the number of people, the more chances they have to congregate to a common place, whether that's a restroom or a kitchen countertop, or a cooler or whatever else. We have to keep that minimized right now.
Okay, excellent.
And talking about being outdoors, remember, playgrounds are closed.
Right.
And it was noted, and we observed parents and grandparents and people taking children to the playground. Those playgrounds are closed. Do your civic responsibility and stay away from the playgrounds.
I had a question kind of follow up to that was texted to me. We've heard to social distance, but what about kids playing outside or visiting with neighbors at a 6-foot distance while outside? We talked about this a little bit, but I know, as a parent, this is a question that a lot of people have on their minds.
There is a way to socially distance your kids to play. They can get on the driveway and all do, driveway chalk by themselves. 2 moms or 2 dads don't need to congregate right next door or right, shoulder to shoulder to each other. We can keep a comfortable distance and have those kids at least communicate with each other and be out there. Again, this is not a prison sentence or a jail sentence. This is just to get people thinking about their social responsibilities to stay their comfortable distance away from everybody. Little kids can't hug. They love to run into each other, and kids are dirty little creatures, as we all know. So you have to remind them as a parent, be a parent. Keep them away from interactions directly. But yes, they can go on bike rides together. You just have to continue to preach about stay away from little Johnny, little Susie, and keep a nice distance. And I have a 4-year-old myself. She understands there's a virus. You can teach these kids there's something dangerous out there, but you can't see it. So stay away from it.
Yeah, absolutely. Next question, again, Dr. Bracken, is hydroxychloroquine, maybe I said that right, azithromycin, effective? And if so, when will it be available to patients?
I could probably spend the next 9 hours talking about treatments with Dr. Patel and myself, options that are out there. Hydroxychloroquine is a malaria drug. It got a lot of press. There are animal studies. There are laboratory studies that say, yeah, there is some benefit to it early on in the disease stage. But COVID-19 has a preliminary phase where people have a lot of upper respiratory tract infections type of symptoms, and that leads up to about 7 days or so. Then you fall into week 2, and that's where we see this dramatic downturn in a good percentage of people. Once you get past that dramatic downturn and people are critically ill, they're in the hospital, we see less effectiveness of the hydroxychloroquine. The problem is there's no national stockpile of hydroxychloroquine, and it's all getting shipped to areas of the hot spots in the world, and that's great. We don't have to go out and start stockpiling hydroxychloroquine for ourselves. There is a role. It's a very high interest in research right now. The azithromycin, in addition to it, came from a French study that's been a bit debated whether or not there's much benefit in adding the azithromycin. But please, and you can speak to your health providers, you can call the union hotline as well and talk with the nurses about, do I need to get on this drug? And trust the information that's out there from the CDC and the ISDH on it.
I'd like to emphasize there is no proven drug to cure this.
Right.
Our care is still supportive. We meet as a group of healthcare providers in multiple subspecialties, as I said, every few days, including infectious disease, pulmonary critical care, hospital medicine, and we try to come up with a wise strategy in an area that nobody really knows the answers to. So we are discussing the data that's coming from China and Spain and Italy and even in the U.S. from Mass General at Harvard and in New York. I've personally been on the phone with providers in New York and Boston to try to determine what best practices are. And right now we're still kind of, shooting in the dark, really. And so we do try to utilize these therapies to the best of our abilities, but they are in short supply. And so the key really is to just not get sick in the first place.
Mm-hmm. Absolutely.
Yeah, an important point. All of our treatments are unproven and experimental. And I read an article of someone coined the phrase, we're trying to build the plane that we're currently flying. And that's really what it is that we're doing. So.
Okay. Another question, this is from Daryl in Jasonville. This could go to either of the doctors. If a mosquito bites someone with coronavirus, then can the mosquito then transmit the virus?
No.
All right, that was easy enough. All right.
I'm sorry, I'll expound upon it. It's a respiratory-borne virus. It is not a blood-borne virus, and mosquitoes obviously siphon blood from you, so no, it cannot be transmitted that way.
Okay.
Not that's known.
Good to know. 'Tis the season. Brendan, question for you. Is there anything the public can do for the staff and first responders, such as a drive to raise funds for medical supplies or financial aid for workers?
We actually had an exercise this week where there's an organization that wanted to make care baskets for police and firefighters. And as we've all probably heard, the fire stations are locked down. And one of the worst things you can do, it's a good-hearted effort, but if you're taking something and bringing it into that environment, you're possibly bringing contamination within. So I absolutely do not recommend making care baskets for providers right now. If anything, your moral support, letting them know that, hey, we care about you. One thing we have to think about is who takes care of these people that are taking care of us. And that's something that, we rely on these providers to help us in our time of need. But when they get home, who's there for them? So, reaching out by a phone call, a Facebook message, or something to them directly saying, hey, thank you, I care about you, I appreciate it, I think would go miles. As far as finances goes, choose an organization that's near and dear to your heart. Whether it be a faith-based organization, the United Way has a fund going now. I think the Community Foundation does. Those are pros that work with agencies within the community to help distribute funds where necessary.
Yeah, absolutely.
May I add, there has been a shortage of blood nationwide as donors have been socially isolating themselves. Blood banks throughout this country, in the Wabash Valley as well, have made efforts and are doing all the appropriate social distancing and protection for potential donors. So if there's nothing else you can do, donate blood.
Yeah.
And it goes back to what Dr. Brucken said about the mosquito. This is not a blood-borne disease, because we had a question that came into our office, are they screening the blood at blood banks? And it's not a blood-borne disease.
Absolutely. We have one more question that we'll get to, and then we'll do some kind of closing remarks before our live section ends. Let's go to both the CEOs. Do the hospitals have backup plans in place if the hospitals become overcrowded?
Okay, Mayor, is it your turn or my turn?
Nathan.
Certainly, I think all healthcare organizations have been working on this very diligently over the last couple of weeks. At Regional Hospital, we certainly have, as I mentioned, and I know Steve has mentioned it as well. We are preparing for the worst within our capabilities. I applaud Steve and his team at Union Health for reaching out and working together with our organization to make sure that we are together able to handle this safely to the best of our abilities. And once we get beyond our best capabilities, we'll have to reach out to other partners around the state and perhaps even in neighboring states to help out as well. So the short answer to your question is yes. We just hope that we don't ever get to the point where we exceed the capacity that we're planning for.
Absolutely. Thanks, Stephen.
Nathan said it well. I just add, we have seen the models. We're getting models on the surge from the state, and both of us feel that we have the capacity to handle it, yes.
Excellent. Good. Well, right now, before the live portion of the program ends, we are going to continue this discussion on the Vigo County Facebook page as well via their live stream. But I do want to, again, thank the Vigo County Health Department for organizing this. We're going to turn it over to our panelists to provide a couple of closing remarks. And again, if we get cut off, this will be continuing live on the Vigo County Commissioner's Facebook page, I believe. So Dr. Bracken, I'll start with you.
Thank you. I'll try to keep it brief. I get a little long-winded. Please understand, we have a 2 to 3 week interval. It's our last window. It's our last window of opportunity to do what we can to shut down the spread of the virus in the community. You're not going to see the numbers. You're not going to see the sickness until 2 to 3 weeks later, when we can potentially be overrun in our healthcare delivery system. We are prepared as we can be. The statistical waves, the models that are coming they are frightening, but this is a time to be responsible socially. Wear your mask, stay home, be very kind to your neighbors as well, and do what you can. Do your part, please.
Yep, absolutely. Dr. Patel?
To echo those words, stay home, be safe, take care of each other, take care of us, and just please heed this warning, because this is our chance to prevent unneeded sickness and death.
Joni?
Take it seriously. This is our last chance, or could be our last chance. We're at a very narrow window, echoing what they said. And if you don't step up and do your part, if we don't step up and do our part, which is staying home, if you have to go out, listen to go over all those steps that I talked about of, wearing the mask out and all, being hypervigilant. This is going to be life or death. Stay home.
Absolutely. Steve?
Sure. I'll tell just quickly, viewers in the Wabash Valley, I think of those that may not get the flu and how their health is. And I would tell you, we live in an amazing community that cares. The faith-based community and the faith foundation that this community has, I see exhibited every day. We had a patient just a couple of days ago, and obviously we haven't talked about our visitation guidelines are very stringent right now, where you can't visit. And we have a patient with the COVID-19 now that their employees that the individual worked with came and asked to meet in the parking lot and asked their caregivers if they could come out, met them in the parking lot and prayed for them. That's the type of community we have that turns to God, that realizes this is a spiritual part of what's here and consoles them. And I'm thankful to live in a community like that.
Absolutely.
I'll just echo what the other experts in the room said. Stay at home, heed the warnings, take this seriously.
Yeah, absolutely. Brendan?
Kristen, as an elected official, we're supposed to give calming words and make everybody feel good about this. This is scary. And I've been trying to think of something that would be great to tell everybody to help inspire them. And I struggle with it because we are struggling every day. We're reactionary. We're trying to do what we can. But I will assure you that your elected officials in Vigo County, the employees, city and county, we're working for everybody's best interest. And, this is tough. It affects all of us. And I don't know what else to say other than we will get through this.
I agree, and I think that's in times like this when community leaders can come together and, get that message out consistently, stay at home, social distancing, and in the next few days, I think there'll be a campaign to ask all of those community leaders, including the mayor, commissioners, everyone, to really echo those sentiments, because as a community, we can make it through all of this.
Sure.
So we do have a few more questions. I'll go ahead and start asking those, knowing that we'll probably cut away on the live feed. Joni, something that we didn't get to is what happens if individuals in the jails, juvenile centers, senior living centers become infected?
Those are highly communicable living quarters, and so those entities already have plans in place. One of the first things they do is to do isolation and quarantine, to disinfect, to limit travel or visitors in and out of the place, and screening employees. I have met with the jail, the juvenile center. We've reached out to senior living centers to make sure that everybody's doing their part, that if there was an outbreak, be familiar with your plans, reevaluate them, look at what ISDH is recommending, CDC is recommending for long-term care and for the incarcerated.
Okay. One more question, not on the list, but just kind of an addition. Hand sanitizing versus hand washing. What is the comparison there?
They should be equally effective if you're using an alcohol-based hand sanitizer. You do want to make sure you're using good warm soapy water, covering the backs of your hands in between your fingers. Don't forget your thumbs. 20 seconds or more of either. Okay, should be well. The surface wipes and things, if you go to the grocery store and you have, you want to wipe down your groceries, any of the sanitizing wipes are fine. You don't have to get a special brand. The CDC actually posts on their website a list. There's like 286 different types of brands that actually are effective with eliminating the virus from the surfaces. Read the labels. If it says on there it eliminates 99.9% of bacteria and viruses, that's going to be fine.
Okay.
I think the other thing is my wife is from Houston and is used to kind of panic buying, and went to the store for groceries 2 months ago and started seeing people kind of collecting lots of hand sanitizer. Hand sanitizer is used actually out of convenience. It's something that you keep in your pocket, like I have right now in my pocket, for when I don't have access to soap and water at a sink. So soap and water is still your best friend. You can use that in your home. We do not use hand sanitizer in our home. That is the bottle that's left next to the door, so we can take it with us. We leave one in our car. So hand sanitizer should not be used at home if you have soap and water.
One very important thing that I preach at the hospital with my nurses and with my patients and everything else, and even at home, and I would drive everyone crazy, I tell people, keep your hands away from your face. That is a way that this thing can be transmitted to you by touching your eyes, touching your nose, putting your fingers in your mouth, eating finger foods. Always think of your hands as being contaminated. Once you've washed your hands with soap and water, use hand sanitizer thoroughly, now your hands are clean. So now if you do need to touch your face to put on makeup, or if you're wearing contact lenses, try to wear glasses as much as you can. If you absolutely are going to wear your contacts, make sure you've washed your hands thoroughly. And surfaces in the environment can contain, contagious viral particles. So keep your hands away from your face, and tell your kids keep their hands away from their face.
I'm going to go one more question. I have teenagers. They don't have school now. One wants to see her boyfriend. The other wants to go do things with friends. We were talking about this a little bit earlier. Stress, speaking to teenagers, how important it is that they abide by these rules.
Anybody?
I have a 7-year-old. I'm out. She better not have a boyfriend.
Mine's 30.
We've been doing
30,
Zoom.
31, and
Yeah.
30.
It's difficult. Real life is still going on, but utilize the technology that's out there too, with FaceTime and Zoom and all of these other platforms and things. Preach to your older kids too, particularly if they understand it. It is a short-term sacrifice for a long-term goal.
Yep.
So.
Absolutely. Thank you. My daughter will appreciate me asking that.
Well,
Brendan?
we were dreading the day when Mia wanted to start using an iPad or iPhone. She's 7. She now has both. And we did that because, not to get too personal, but to mitigate our risk at our home, because my wife's in healthcare and I do what I do, we moved Mia out of the house. And as much as it just tears at my heart right now, we set her up with Messenger so that we can talk. So this afternoon we did funny faces where we did the graphics, and I had a hat and a mustache and all kinds of stuff, and that was fun. But what I've noticed more than anything, though, is Mia stays in touch with her friends. Yeah. And she's limited on how much time, but they get together, and that helps. Because while we have a wonderful street with 9 girls all under the age of 10 on our road, we're not letting her play with them. So they can communicate through the Zoom or whatever. Now, about touching your face, I touch mine at least 6 times here. And I notice we've all been on Zoom calls. The game now is it's kind of like bingo. How many times people are actually touching their face. So we all do it. Those habits are hard to change. But in this case, I think technology is helping us. So.
Absolutely. Well, that was the end of our questions. Is there anything else that we haven't touched upon this evening, panelists, that you'd like to mention?
The governor has issued his directive guiding us for what we need to use. Use it responsibly. Because this is a home rule state, it does leave the power, the authority to local officials to make those rules more narrow. We would rather not go that route, but if it's necessary, we will go the way of making it more narrow. So
Can I add to that, Joni?
Yes, please.
So the county commissioners, Brad and Judy and I have been involved every day with issues. And they're issues because of recklessness.
Yes.
We do not want to be those people that have to say, you can't be open, you can't conduct this or that. Saturday, Sunday, I was out in the community monitoring retail areas. And I never thought I would be doing that. I'm watching people go in stores empty-handed. I'm watching them leave stores empty-handed. And I wonder, why were they even in there? I made a trip to Meijer, mask covered, to shop but also observe. I was amazed as to how many people were in there getting that 1 can of spaghetti sauce.
Yeah.
We don't want to have to impact or set ordinances to address this. And I think as long as people respect the rules, don't overcrowd the trails like we saw on the Monon Trail in Indianapolis where they had to shut that down. If you're going to go golfing, don't do 2 people in a cart. There's just a lot of don't do's out there. And I think if people abide by it and they respect other people, then we're going to be okay. But we absolutely do not want to have to put ordinances in place. And we don't want to enforce them. That'll take this to a whole new level
Right.
that we don't want to be in right now.
And other counties have, Tippecanoe County, they
Right.
have issued an ordinance.
Whole cities, Columbia,
absolutely.
Missouri. And I will say, when I see these video clips of New York City and Times Square and a single police officer walking through and there's not a soul to be seen and the streets of San Francisco completely empty, that's a dream. That's at its peak. That's what we need to be seeing right now. We're not seeing that. You can go out anywhere and traffic is just, it's everywhere. So ask yourself just, do I really need to be out? And if you are sending, like I said earlier, with grocery store trips and food runs, send one person. Don't go. I know everyone is at home and everyone is bored and they think, well, Meijer is open, I'll go and shop. No, not now. Do that 6 weeks from now or whenever that might be when we get back to life as usual. So put yourself into that short-term sacrifice category. Just use your head.
Absolutely. Thank you again to all of you for
Thank
what
you,
you're doing for the